What's up, everybody? Today we are talking about medical and survival tips. We're going to go through a hodgepodge of different myths that students have asked me about and things that I still see being preached in our day to day life. So, without further ado, let's get to it. And besides that, let me know what myths or what things that are your go to things to think about that you've heard from your parents, your grandparents, your friends. And let's see if it's true or not. Let me know in the comments. Awesome. So these questions were submitted basically from our students and also the general public, whether you are viewing from Instagram, YouTube, TikTok. Let me know what you think is true or things that you have questions about, because a lot of these things have very, very severe side effects or consequences if you do them. And these are things that people have been doing for quite some time. So let's get the ball rolling for some survival myths. One of the things that we talk about both in our class and also in many other survival classes is the rule of threes. Now, I think the rule should be maybe labeled as a guideline because these aren't hard and fast rules. So the rule or the guidelines of threes mentions the priorities that typically change your physiology so that you can no longer care for yourself or other people. So when we talk about 3 minutes, 3 hours, 3 days, and 3 weeks, and 3 months or beyond 3 months, and typically that relates to cold or hot, so being too hot or too cold, oxygenation, which is the first one, and then it's your normal body temperature. Then it's hydration after your normal body temperature, and after that, hydration is food in the 3 week mark, and after that is typically companionship or psychiatric or spiritual resilience in the wilderness. And why I say this is more of a guideline is because even if we think about very simply things that we would probably encounter on a hike is 3 days without water. I don't want you to just think that you'd be good for 3 days because whether it's kind of a situation where you didn't expect to be in a survival situation, and oftentimes, to be very honest, we underhydrate when we're hiking and camping because we're so excited to be outdoors, and our water bottle may be in a far to reach place in our pack, and we typically drink less than we're supposed to. And you can really tell in your urine it being either really dark, or as we progress to more dehydration, it might look a little brown tinge or even red tinge. And that happens when your muscles are so dehydrated, it starts breaking it down and cause something called muscle breakdown or rhabdomyolysis. So when we think about the guidelines of threes or the rule of threes, think about hydrating more because 3 days without water really isn't relevant or really isn't true when we think about the average person who gets lost, or if you're in a combat situation where you are fleeing from enemy contact, you will be in a point where you are so dehydrated and cramping and not really able to function because your muscle might be seizing up and your dehydration might be changing your electrolyte imbalance in your body that make it really difficult for you to operate. So in those really hot environments or even cold environments, be sure to be drinking more and to anticipate more and have that on a higher priority than saying, oh, I'm good for 3 days. So that's kind of our first one. And the next one along that line is drinking urine. We've seen it on Bear Grylls. We've seen it on many survival kind of movies and videos, but it really isn't the best thing for hydration. Your body gets rid of a lot of that waste, and with that, a lot of salts, a lot of toxins. And when you put it back in your body, it is likely the case where you are concentrating things a little bit in a bad way and causing more dehydration and also kidney injury. And your kidneys are the thing that filters all the badness to get out of your body through the urinary tract. So if you disrupt that or cause an acute kidney injury or necrosis of the parts of the kidneys, then that would be bad, very bad for you because a slew of other things happen on the your regular body function with that. So do not drink your urine. Another thing from survival myths, we talked about moss and directions. So typically, when you're in the northern hemisphere, the sun rises to the east and sets to the west. And for you homesteaders out there or people who like to garden, if you are in the northern hemisphere and have a south facing garden, you typically get full amounts of sun. So the thought is, if the most sun is on the southern facing side in the northern hemisphere, the north side should be shady, and moss typically grows a little bit better in the shade. But the thing is, moss can grow pretty much anywhere. It might be a little bit dry in that northern or that southern area, decreasing the likelihood of moss growth. But just because a moss is growing on one side of a tree, a rock, or so forth, it doesn't necessarily mean that location and that direction is pointing towards north. What I would prefer you do is learn how to do a sundial, have a compass, have multiple different redundancies, and getting familiar with your area so that you know which different landmarks are pointing you in the right direction, and use it as not necessarily a one singular kind of clue for a direction, but something that may kind of justify you thinking that area or that direction is north, just based on sun directions, based on your sundial, based on maybe a very primitive compass where it's just one of those little little compasses. So with all that being said, Andrea, we're talking about some survival myths over here, so welcome, welcome. Another one that really came under my radar is antibacterial underwear, or antimicrobial underwear. And this was something that came out very in fashion when I was just joining the military more than a decade or so ago. And these antimicrobial underwear are basically like quick dry type of things. So it doesn't get as soaked with sweat and grime and all these gross things. But at the same time, I think it's very mislabeled. Quick dry does not mean antimicrobial. And there's not really anything in those materials that actively kill bacteria and microbes. And what ended up happening is we had someone in basic training put on those antiseptic or the so-called antibacterial underwear, and that was the only pair of underwear that they did for basic training, which is more than a month. And actually, I think it was soldier qualification. So we were in the bush and pretty much only using baby wipes and a little bit of water for our personal hygiene, and they kept on that underwear pretty much the whole time, and it gave them such a bad diaper rash basically that they had to be medevaced out of there because of the friction, because of the bacteria build. And it doesn't negate your need to do general hygiene. And one of the things that we really advocate in survival situations and also in military operations is to maintain your hygiene. That's one of the reasons why we encourage people to like shave and keep clean, and also to wash daily, because if you have little small wounds, especially in the groin and in your sensitive areas, those things can put you down or at least hinder your movement in a very big way. So, big bust. Antimicrobial underwear is not a real thing. And you might know this one, but people drinking alcohol to stay warm. Drinking alcohol, what it does is it dilates the blood vessels in your periphery, so your hands and feet, and kind of like your ears and your face and your nose, and that type of thing. But your central core, it kind of diverts a lot of that heavy blood flow from your core, which you're trying to maintain, to your extremities. So you might feel warm or flushed in the face, but you are actually doing yourself harm if you're trying to keep warm and you're taking a swig of your alcohol. In the same kind of vein, where we're talking about cold like things, I've seen a few videos now that advocate for Wim Hof type of training, or not training, but Wim Hof type of sequences after severe hypothermia. And they say like it can help you rewarm yourself. Now, the fundamental things that you need to think about is it mild and accidental exposure to the cold? So it might be a polar plunge or falling into the river and immediately getting out, versus severe. So, severe hypothermia, one big distinction that you want to make is, number one, are you having any kind of change in your mental status, your equilibrium? Are you talking funny? Are you walking funny like a drunken sailor? And if so, that would kind of qualify you as more of a severe hypothermic condition. And why that's important is because your heart is very susceptible to moving around and getting blood flow back to the core. So what happens when you're moving around is your arms and legs that are kind of frosty and frozen loosen up, and that cold blood returns to the heart. Now that can shock it and cause a very fatal arrhythmia. And arrhythmias without an AED in the wilderness can kill you very, very quickly. And it's one of the things that a lot of rescuers who rescue people with prolonged exposures in, let's say, the ocean or ice water types of circumstances are super scared about. And that's why they leave that water kind of horizontal instead of vertical. Excuse me. And also trying not to move them or encourage them to walk. And at the same time, these are the types of situations where your mentation, your ability to stay awake and control your breathing and all that is a little bit altered. So you also don't want to be giving them high foods or hot fluids as well, like you do with mild hypothermia, where you would want them to kind of move about, get some warm blood flowing, and also have some high calorie and also warm fluids. But that's in mild hypothermia, and that's very different from severe hypothermia. So, with that, also let me know what you think is something that you go by, almost like your rule of wound care, or it might be things that you pack in your first aid kit, or things that you kind of thought were true. And let's debunk them. So, let me know in the comments, and also just send me videos, and that's the key thing. There's a lot of misinformation out there, especially on the medical side. So if there's a medical video that you said, "Oh, I learned something," or "Oh, I'm not sure if that's true," send it to me and let's debunk things. For other things, I had someone message me when we were talking about survival kits, and one of the things that I highly recommend in my survival kits or multiple different things to keep warm, whether that's starting a fire, extra clothing. And one thing that I really, really advocate for, and something that I typically always bring with me, are space blankets, or specifically space blanket tarps. And these are kind of like those little packets of silvery aluminum foil looking stuff, and that reflects upwards of 80%, typically over 90% of your own body heat back to you. And that's super important for hypothermia, making shelters, modifying your shelter so there's more reflection coming back into it. But one of the concerns, or one of the things someone messaged me was, I think they were using Sol. It's a brand, SOL types of bivy bags. And with those bivy bags, they're saying, "Oh, it doesn't work because you just sweat in it, and really, it's not a good shelter because you just sweat. There's a bunch of moisture, and then you end up being cold." Now, with that, I agree in some contexts where if you are in that environment and you're using it as a bivy bag and you're putting your head in it, that's going to be a lot of moisture in and of itself, because you are breathing out a lot of moisture just with your breath. So don't tuck in your face in your sleeping bag or in the bivy bag at all, ever. And number two, is if you're incorporating it in your shelter and there's a bunch of moisture in there, it might be the case where you need to modify that shelter to get the best of both worlds. So with those Malar tarps, one thing that you can do, it's something called a super shelter. If you've never built one before, Google it on YouTube. Our students know how to make them here at Survival Doctors, and those types of shelters are the type that reflect heat back into your shelter with a fire in front of it. So it's as simple as having a space blanket tarp on one side, a clear type of sheet in front of it that allows kind of like a greenhouse effect to have that radiant heat from the fire pass through that clear layer and into your shelter, where that space blanket reflects it back into you. And you can get very, very hot sauna like temperatures with a fire 2 to 3 feet in front of that. Now, if you're noticing a lot of moisture there, there's a few things that you can do, and that's one of the reasons why I love these space blankets, because the reflection ability of this is just so important. If you're noticing a lot of moisture, and even if you have a lot of moisture just in your tarp, think about just putting it a little bit further away, making sure that your tarps are very tight, because if it's kind of loose, number one, rain can get through if there's any sagging to it, but also moisture can drip down. If your tarp is tight and angled, that moisture should find its way down to areas that don't touch you. And in winter months, and one of the reasons why a lot of military tents have multiple different layers is because that initial layer, there's always some natural moisture inside your shelter. whether that's you coming in with damp clothes or snow on your clothes, or if it's your natural breathing. Your shelter should be at least like 1.5 to 2 feet above your head, so that moisture has a place to go. And in addition to that, you can have a layer of a cloth or something like that. So extra shirts, or if you have a blanket or a shamog, that can take a lot of the moistures and actually cause an additional air gap in your shelter and making it more warm. So don't be discouraged about people poo-pooing some space blankets, because they're likely not using them optimally. And it's something that I highly, highly recommend, and something that you would need if your patient did have severe hypothermia and you're trying to rewarm them actively in the field before evacuation. And we have a comment over here. Um, let's bring a myth about reviving a flat line with AED. So one of the the things about AEDs is they're meant to shock, right? They're meant to shock an abnormal rhythm like ventricular tachycardia and VFib. So those are some of the dangerous things that can happen when you're either too cold, too hot, super dehydrated, or have something else going on with your heart. But when we talk about circulations in our kind of algorithm of how we evaluate and treat someone, one of the early things that you want to be doing is checking pulses. So if you check a pulse and there's no pulse and they have a weird arrhythmia, that's still considered a pulseless rhythm. And with a pulseless rhythm, you need to pump the heart. So your first thing that you have to do is to pump the heart. So you're doing CPR if you don't feel a pulse. And once you get a pulse back, then you can kind of reevaluate and have the AED reevaluate as well. On the medical side, it was funny because I was touring my buddy's distribution center recently, and I won't say where it is, but it's very common and it's still being sold, and it's being sold by very reputable places. Snake bite kits. Number one, they do not work. Number two, if even if they don't work, it's mildly worse that you're putting them on. So snake bite kits, typically they come with a little IV tourniquet, which isn't, number one, a good tourniquet to begin with. It's just a small little thin rubber. And for those of you who take my courses and lessons, we know that our tourniquets need to be at least an inch and a half wide. And these tiny little tourniquets are maybe like this wide. So really thin, really floppy. Looks like the stuff that you would do just to get an IV. And in addition to that, it comes with like this suction cup type of device. So you pump, 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 and you're basically giving yourself a hickey. For the majority of snake bites, those snake bites are lymphatic, so not in the blood, and sucking the blood, electrocuting the skin, and doing all these things with the snake bite kit turns that lymphatic kind of bite into something that may cross into the blood, and that makes things worse. In North America, the two kind of venom classes are typically from like the viper type of snake family. So think about your rattlesnakes, and then coral snakes, and even coral snakes that have a neurotoxic type of venom, they are coming from specific warmer areas, and not all those warmer areas have coral snakes with severe types of venom. So it might be the case where you get bit by a coral snake and you get monitored in the emergency department, and you might not get any anti-venom. But the main thing is, don't use a snake bite kit. Do not buy a snake bite kit. I only have them to tell people that they don't work, and if anything, they make things a little bit worse. So don't use them. Another thing in regarding like snakes and also other animals, I want to talk about jellyfish, because one thing that I did when I was young, I think I was in Cuba, and in Cuba, I was just boogie boarding, and for some reason, I, I just remember like my legs couldn't work, and then a sharp burning pain just like struck my leg, and I look back and there's this big old jellyfish just latched onto my inner thigh. And I was lucky because I had my older cousin. I was probably like 8 or 9, and my cousin was probably in his teens, and he like, it looked like I was drowning because I was struggling big time because I couldn't use my legs anymore, and I was trying to paddle with a boogie board with one hand and getting just like rolled by these big waves. So he ended up getting me out. And the first thing that I did, and I think I got it from like Seinfeld or something like that, was pee on the jellyfish wound. And it's funny because a lot of people do it, a lot of people still do it, and it's not only, again, something that doesn't work well, and it's also something that can make things worse, and I'll tell you exactly why. So with jellyfish things, the two things that I want to make very clear is there is some discrepancy between where jellyfish are from. So these specific recommendations are for Australia and Indo-Pacific countries, and I'll kind of list a few of those Indo-Pacific countries because some of them may be pertinent to you guys going on vacation or if you're from there. So Australia is one of them. Bangladesh, Bhutan, Brunei, Cambodia, um, the Democratic Republic of Korea, India, Indonesia, Japan, Laos, Malaysia, Maldives, Mongolia, Myanmar, Nepal, New Zealand, and Pacific Island countries, Pakistan, China. So a bunch of different places. But before you go on vacation, or if you are kind of by the beach in a very hot location, see if it's in those Indo-Pacific countries, because number one, you don't want to be peeing on yourself in either cases, whether it's within these countries or outside. And number two, typically the treatment with this is number one, the venom in jellyfish also has these little nematocysts on them. And those little nematocysts have a little bit of toxins that cause the stinging and the problems. And they release these issues, these toxins, um, when things can be rubbed. So you don't want to rub that area. And number two, with fresh water. So urine isn't fresh water, but it's not salty water. So the nematocysts are more stable with salt water. So what you want to do is with gloves or with some kind of pincers or chopsticks or whatever, you can take off the tentacles and then wash that area with salt water and not regular bottled water. If you do bottled water, those nematocysts will discharge, and that stinging and all the consequences of those venom will be worse. So do not do that. And number two, if you have this, and if you're going in a tropical situation, one of the things that you can get if you have access to, let's say, um, department stores, or not department stores, but like gas station type of deals, grocery stores, is get some vinegar and keep it in a small little bottle. You can even bring it with you through your check-in bag. Just a small bottle that's less than, I think, 4 ounces is the requirement, and bring that with you because that is something that can help with that the nematocyte discharges and stabilization of that wound. So vinegar works a lot better. And if you are in an area outside of that area, typically what you want to be doing is also you can use your fingertips or glove fingertips to remove those tentacles. It can sting you, but it's not super severe. And seawater again. But another thing, if you're outside of these Indo-Pacific countries, is if you're having a lot of pain with those things, you can use hot water. So how hot? There is exact temperature, but in the most likely circumstance, you're not going to have a thermometer and testing water. So it is the warmest water that you can tolerate with your hands without feeling like it's burning. So like hot tub type of temperatures. And that typically relieves the pain in those types of burns. So those are countries outside of the Indo-Pacific countries. One As we move on to some of the other medical tips, two ones that I see over and over again. It doesn't matter if people kind of dispel this over and over again. There's always people saying that this is their go-to, and this is for massive bleeds and using tourniquets. Tampons, yes, that's another one too. So Andrea said tampons, so we'll jump to that soon. But for tourniquets, people whipping out their belts, especially a leather belt or a rigid belt, and using that to stop a bleed. It doesn't work because number one, there's no a good way to secure it because all those little holes are kind of far out, and number two, there's no way to twist it. So if you have like a belt, let's see if I have one in reach. I don't think I have mine over here, but there are some. There are some that have kind of a ratcheting device, and typically they might be long enough for people who are quite thin. So you can use that as a tourniquet. But if you don't have an ability to twist that belt and it's not thick enough, it's not going to work as a tourniquet because tourniquets need a mechanism to make it tighter and to secure it in place. So don't use a belt. I'd much rather you do direct pressure and fashion a proper improvised tourniquet. And if you don't know how to do that, check out our courses. We'll put the link in the descriptions. Another thing that people have been using or recommending is rope, specifically like paracord as a tourniquet. And what they say is like, like they know tourniquets are supposed to be wide and this is a last resort. So they're going to use rope or paracord and they just wrap it around their wound or wrap it around the area above the wound. And then that's kind of their tourniquet that's technically wide enough because it's rope next to each other. But what happens when you immediately twist with a windlass, kind of like a stick, it kind of shrinks up and gets really thin. And with that, it just loses its effectiveness immediately. So do not use just rope. And one thing that Andrea, one of our students, and she's also a wilderness first aid instructor, mentioned tampons. Tampons specifically for bullet wounds is the biggest common misunderstanding because tampons are great at absorbing blood. So if you want to clean up a mess or use it as a bandage on top, that's fine. But to pack a wound, it's not great. Number one, it's kind of bulky, so you have to have like a pretty wide gauge wound. And number two, it absorbs. It doesn't apply pressure. So even if you stuff it in there, especially with high caliber wounds or impalation injuries, there's typically more space in there besides just a poke hole straight like that. So really not good to stop a bleed in that context. If you want to use it as a fire starter, if you want to use it as a bandage on top of things for minor wounds, you can go ahead and do that, but do not use it to plug up bullet wounds because do not work. I'd much rather you have something as simple as gauze like this and learn how to pack a wound. If you don't, check out our free courses. For other things regarding like blisters and kind of frostbite, they're similar issues, but a different type of mechanism. So either way, whether you burn yourself, whether there's friction, whether there's cold, and you have a blister, those are things that you don't necessarily want it to pop because that intact skin is preventing all the outside world, whether that's bacteria on your skin or bacteria in the ground, bacteria on your own clothing, from getting into the layers that can cause infection. And all that juice and stuff inside of it does resorb if you give it time to resorb into your body. So typically, if it doesn't prevent you from doing your survival tasks, so you're able to make your fire, shelter, signal, and do all that good stuff, and you're able to evacuate to your best capabilities, you don't want to be popping the blister. There's a lot of research on what to do from a medical standpoint once that blister is popped or you're planning to pop it, and it kind of goes back and forth with what to do. But the most current recommendations as of the early 2020s is if you are considering popping it, the idea of popping it and letting it drain, um, there is a possibility that infection can go inside and get encased inside of that skin layer. So I know in the past people have said keep that layer on top. But the recommendation right now, if you are going to pop it, the medical societies want you to kind of de-roof it. So typically the skin on top of it's dead or innervated, so it's not painful. So you can kind of poke and trim around the area so it exposes the wound, and then you just put topical antibiotics on it and treat it as a regular, like let's say gash, and then treat it like that. So that's if you need that extremity or that area to move to do whatever you need to survive. So it might be on your hands, causing you an inability to kind of move and do what you need to. So you might pop, de-roof it, treat it as a regular wound, and then go forth and do what you need to. Same thing for the feet. Another thing, the next one would be gunpowder for healing or hemostasis. So stopping bleeding with gunpowder, we see it in where was it? I think it was in maybe Predator or something like that with Arnold, or I remember Sylvester Stallone doing it too. So maybe it was Rambo, but he basically got a puncture wound and then just lit himself on fire with the gunpowder. And in the operation room, we do have these little electrocutor things that coagulate things and singe things, but more often than not, I would much rather direct pressure because there's consequences of that burn. Number one, if it's uncontrolled and causes more damage, that burn area can cause you to lose a lot of moisture, lose a lot of heat, and increase your infection risks. And really, there's not a good circumstance to use that amount of fiery force to stop a bleed when direct pressure, wound packing, hemostatic agents would do even better. Frostbite and frost burns. So, frostbites, things that a lot of people have been told from their like grandmom and from kind of like oral histories is to kind of rub it if it's kind of numb or painful, and in addition to that, to kind of rub it with oils, especially when we're thinking about burns. So might be the case where you had grandma recommend like a stick of butter to put it on, but at the end of the day, it's not the stick of butter or the rubbing that actually can rupture the blisters and increase your risk of infection. What it's doing, the stick of butter, is cooling the area. So if it's a cold stick of butter, that's sure, it can be an improvised ice pack, but you don't want to be putting direct icy things on it. The best thing that you can do within 20 minutes and up to 4 hours is to run it under cold water, submerge it under a river or a lake for a good amount of time. So they're saying at least 20 minutes. And this was done out of a New Zealand fire department where they had thousands of firefighters who had these serious burns, um, go through these protocols to cool that extremity immediately or as soon as they can after the burns. And it reduces the burn depth, the burn width, the scar tissue, all these inflammatory changes that they saw under the microscope. So that's my current recommendation. If you can, throw out the butter and just go under the sink under cold water and kind of cool that area as soon as you get burned. It's one of the reasons why people, when they burn, they kind of put it in their mouths trying to cool it, but much better if you have a cold water source or a way to cool it. All right. So we talked a little bit about snake bites, snake bite kits. And we basically, just to recap, no sucking, no electrocuting, no cutting or bloodletting, and no snake bite kits. But did you know that you don't need to bring me your snake or that snake head um, in the ER? Like, I don't need to see that rattlesnake. There's one or two antivenoms that we would typically use in the ER that covers all these different snakes as long as they're not an exotic snake. And the chances of you getting bit a second time is higher if you try to find it and capture it or decapitate it. So don't do that. You don't need to do that. Um, we have a question over here: suturing and cauterizing in the wilderness. So, suturing and cauterizing. I do have the ability to bring like a cautery device. It's like has like a few batteries in it and a little wire. It's almost like if you take the positive negative end and use like a thin wire, and it gets really red hot, and you can singe a few things with it. That is what we typically use in, let's say, a controlled setting, to kind of cauterize a few things. But in the wilderness, you really don't need that type of stuff. Direct pressure works just fine, especially if you have some hemostatic agents like Cheetah Sam, Quick Clod, also known as combat gauze. And suturing. Suturing is stitching up. Again, your body has a decent ability to suture itself or to close itself. All you need to do is to bring those edges of the skin close together, and basically it fills it up with things that become a scab and a scar, so scar tissue. So you don't necessarily need to suture yourself with this dirty needle slash fishing line or thread. If you kind of sanitize it, that's great. But if you look at sewing needles, it widens at the base. So it is painful going in, more painful when it's coming out, and you have to do it multiple different times. And each time you're doing it, you're exposing that area for an infection. And you can, if it's not a huge laceration, so maybe it's like maybe a few centimeters long and not more than a centimeter deep, you can treat it as a normal wound, wash it really good, and then put tape on it. And if you have duct tape and tape it on one side and pull it over, your skin approximates quite nicely. And you can give yourself a few days of that for it to scab over. And there's a hack that you can use to stitch yourself with duct tape without piercing the skin. So if you want to see that, that's going to be launched on the Canadian Preppers account. So if you haven't followed them on YouTube, check them out. And I did that while I was in Saskatoon with them. Awesome. So the next one is eating snow. Even if you look up right now, eating snow is not recommended because there's a scary thought that it reduces your core body temperature. Looking back historically, and one of the reasons why in military operations they're often told not to do that, because there have been survival encounters of people getting frost injuries in their mouth from eating snow. So it's not necessarily dropping your core body temperature, but if you're severely dehydrated, your blood is something that helps with keeping your body warm. So it flows to all these different areas. And at the same time, in cold environments, you're peeing more often. We called it cold diuresis. And when you're peeing more often, you're drinking less, and you're getting more dehydrated. That you'll notice that your fingers get a little more cold, your toes are getting more cold. All these places far from the heart are getting cold really, really quickly. So if you are getting really dehydrated, just know that there's other ways to consume snow. And the main reason why we're saying don't eat it is because it pretty much gives you a lot of local frost injury. If you think about people who drink slushies, it doesn't put them in severe hypothermia. Especially if you are actively trying to get out there. So for our veterans out there, for our mountaineers, for our people who are actively trying to get out of Dodge, your body is heating up quite a bit. So I don't think it's going to bring down your core body temperature to a significant degree because whatever you're eating, it's not going to be as big as that huge 1 liter slushy that you get from the gas station. And at the same time, I don't want you to be discouraged that you have no water source and you don't have an ability to create a fire to boil it. What you can do is I highly recommend that you can take some gauze or a pair of piece of your t-shirt or something like that, wrap the snow, and then you can either keep it close to your body. So you just tuck in your sleeve and hold it inside your jacket as you're walking, and you'll notice that it'll be melting a little bit, and just sucking on it with material so that you don't get that frost or freezing injury on your lips. You're able to suck that water and slowly hydrate yourself as you're evacuating out from that situation. So, eating snow doesn't reduce your core body temperature if you're actively walking about. I don't necessarily think that would be a significant factor. If you are sitting down waiting for help in the middle of nowhere already having risk of hypothermia and you're eating snow, that's probably not the best idea. But if you're looking for a water source and you're trying to actively hike out of there, wrap it in some material. You can keep it inside your jacket, or if you do have a water bottle, shove it in your water bottle. Make sure it's not completely full because it won't melt as fast. And then keep it inside your jacket and let that melt and take sips at it at a time. So, the last one that I'll talk about, and if you have more, please comment and send me videos because I'm always looking for more things to debunk. But the last one we'll talk about is fast flowing water or drinking from the middle of a lake. Um, Is it a little more clean than kind of the scummy stuff on the sides? Yeah, sure. But if you look under a microscope, you can still see bacteria, you can still see viruses, you can still see giardia and all these protozoas, eggs, and so forth. And when we think about the amount of, let's say, giardia cysts that you need to actually get inoculated and get sick, it's on the scale of like 2 to 5 tiny little cysts under a microscope that causes issues. So if you can please filter, please boil, and drink safe water. But that's all I have for you today for this small segment. We're going to be talking about more things in the future and doing these lives. Let me know what else you want to know, and happy to answer them. If you are interested in learning more and getting more behind the scenes training in a very organized manner, consider trying our free course or a free trial to our course and hanging out with us on a more regular basis. And with that, I'll open up the floor to some questions.